Skills, okay, you will not have inspection, you will have palpation, percussion, auscultation. You are starting with what? Auscultation. Auscultation, then percussion, then palpation. Yes. Why?
Auscultation, because we have to understand, to know what the sound.
Because palpation is a little bit painful, maybe, that's why we are leaving it at the end. And we're starting with auscultation and palpation. Auscultation.
Auscultation, we start to auscultate from this area.
When is it?
Yes, scope. What do you have here?
One scope.
Auscultation. What you are auscultating these points? Once again, here you are auscultating what?
The large intestine.
These?
Ascending.
No. Are you auscultating intestine?
No.
No.
Liver? So, about the sound over the abdomen. Yes, we can auscultate the movement of the bowel, but these movements may be heard. All these sounds may stop during 15-20 minutes. That's why it's not mandatory these sounds to be present. So we are putting the phonoscope over the intestine. You may hear, you may not. But these 2 points are also used for what? For auscultating of the renal arteries. Renal arteries. Here.
مش من ورا بيفحصوهن هذول؟
Renal arteries. And in case you will hear murmur, as if you are auscultating the heart. Maybe due to the stenosis of the renal arteries. That's it. Next, percussion. Percussion of the...
divided into percussion. No, the one percussion. Yes.
Percussion... Okay, what are the goal of percussion? What you're looking for? You may...
Bowel movement, maybe?
No. The presence of fluid, the question of the fluid, ascites. When the patient is laying... Okay, he is laying down. The fluid is accumulated where? No, in the lateral sides. In the lateral sides. That's where we are percussing how?
Laterally.
And down. Down. Let's do it. Let's do it. Relax, please. Relax. Good muscles. This is tympanic.
كله مصور.
Can be dull if the disease.
Dull in or masses like tumors or accumulation of fluid. If the sound will change into dull or subdull sound, you may think about a fluid, accumulation of fluid in the abdomen. In this case, we're asking the patient to lay on his right side, for example, one side. And what is happening to the fluid? The fluid, when he's lying down on his back, the fluid is put on both sides. When he's lying on one side, all the fluid will accumulate on the right side. It's okay. No changes of the tympanic sound in dull sound, for example. Come back. This is the only goal of percussion of the abdomen. Looking for the fluid. That's it. Okay, we have percussion of the liver and the spleen. Is the next step. Now palpation of the abdomen. We have 2 types of palpation: superficial and deep. Superficial palpation, you should know and you should show, and you'll be asked, for example, what is the order of clinical skills. First of all, you are showing practical skills, and then you're coming into the room and you're talking with the teacher. And the teacher may ask you, which are the 9 regions that you are palpating? Name them. This is
شو اسمه؟
yes, left inguinal, then left or it's maybe lateral side or flank or lateral side. Okay, left lateral side, left. This is hypochondrium, left hypochondrium, epigastric region, right hypochondrium, right lateral, right inguinal, suprapubian, okay, suprapubian region, and umbilical, and umbilical. This is the order, and you should name these 9 regions and palpate them. Palpation. You should start with. You are palpating them in an order. Yes, like circle. Okay, don't be afraid. You should palpate. You should palpate. Palpate, not touch. Yeah, but start from here. Inguinal, okay. Lateral, left hypochondrium, epigastrial region, left hypochondrium, left lateral, left inguinal, suprapubian, and then umbilical. The same will be in the patient. Why you are laughing? You are not ladies. You are doctors.
Yes, we know.
لا حياة في العلم.
Which are you'll be asked? Which are the what kind of information you can find during palpation, superficial palpation? You're looking for pain regions, big masses, hernia, maybe hernia of the linea. It's umbilical hernia or linea alba. And yes, and the regions where the abdomen is tonus of the muscles, defense of the muscles, muscular defense, so-called muscular defense. You are palpating and the abdomen is not soft. You can appreciate the muscle defense. Usually, this way the patient is protecting himself from pain. For example, appendicitis, you will not be able to palpate this region. And deep palpation. Deep palpation should be correct order and correct method. Order. Name me the regions that you will palpate. First is
Right inguinal.
we don't have inguinal colon. Parts of the colon. This colon is sigmoid. Next. Cecum. Next.
Ascending.
Chief of the group. No. Iliacecum angle. Then, sigmoid, cecum, iliacecum angle here. Next, descending, then
Ascending. Transverse.
then stomach and pyloric
Liver.
region.
Region.
This is the order. Then, which are the 4 main steps of this palpation? First step is correct placing of fingertips parallel to the that region of the colon. Next, skin cold. Third,
with breathing.
Pressing and forth sliding.
Yeah.
If you want to do it once again, you are not beginning with sliding. You are beginning from the beginning.
Yeah.
Because he will contract his muscles and you will be able nothing to palpate.
Yes.
How many centimeters you should?
5, 6.
Till 4, 5 centimeters. It is more difficult in young persons with well-developed muscles. When the patient is soft, with soft muscles, it's easier to palpate. Please, so. Okay, maybe you will do it. Yes.
حبيبي
The chief is not doing everything for everybody.
انت تشديش
So,
Sigmoid.
first, sigmoid. Sigmoid, it's important to put correct parallel to sigmoid is here in the inguinal. So the fingers should be parallel to it, like this.
Yes.
Please.
Like this.
Like this.
Okay.
Make
تشديش.
something more. When you are pressing, what you should ask the patient when you are going
Is it
down.
painful or no?
To breathe.
To
Here.
To breathe and when
inspiration,
inspirating, yeah.
نفس. فلي.
Did you make the skin cold?
Yes.
I didn't.
Once
Once
again,
again.
okay.
You are putting the fingertips on
Yeah, like this.
like this.
Oh.
Skin hold. Okay. And slide. Okay. Next. It's not palpated. I know. Next.
Like this.
Like this.
Well, like this.
Like
Okay.
this. This is like this. Cecum is like this.
يلا.
Skin hold. Skin hold towards the umbilicus. Yes, towards the umbilicus. What you're doing? Pressing and sliding quickly.
Doctor, first of all, I make
Skin hold like this.
okay, I didn't know. نفش.
انزل لتحت واطلع. خلاص واحد.
Good. It's okay. Your life. Iliocecum angle. Iliocecum angle from trochanter superior anterior from here. Umbilicus. This segment you should divide in 3 portions. Yes.
Okay.
And yes. And between the first thread and second thread. Here, perpendicular to this line. Here.
Upwards or downwards?
Towards.
Okay, towards. يلا روح.
Don't make him laugh.
I can't reach anything, doctor. A lot of
I
muscles.
know, because a lot of muscles. I know. I know. Be patient. So,
Again?
what about, not again,
والله برخي بس شو تسوي؟
descending.
Descending. Okay.
Descending column. You should help yourself with your left hand.
حط ايدك ورا ظهرك.
Bring all the, yes, bring all the tissues towards your hand. Your hands should meet.
تشدش.
تتنفس.
Okay.
تنفسش.
Here, towards the umbilicus. Towards the umbilicus. No, from.
كل شيء
to
للumbilicus.
To umbilicus.
تنفس.
Inhaling, exhaling, and sliding. Sliding.
سوي شيء اشتراكتور ايدك اشتراكتور.
Okay, like this.
بشد يا عمي بشد.
Okay, once again, inspiration, expiration, and relaxing. Okay, next. The same. Help yourself. No.
Like this?
Like
I
this.
can't do that like this.
You will.
يلا.
للumbilical.
It's easier this way. Okay. Relax.
يا زلمه
Relax يا زلمة.
حالك. دكتور
اخي والله بشد والله هو.
Like this on
شو تسوي اخي بوجه ليش يفكرك انت؟
Yes,
on
okay.
the girls.
خلاص اوكي كمان. I'm
Okay.
relaxed.
Next, transversus column.
We don't need
Before
this hand, right?
palpating, no. We are using the left hand, only descending, ascending column. That's it. Transversus column. Where we should look for transversus column? First of all, what we should do? We should find the lower margin of the stomach with the help of an endoscope. What is an endoscope?
جيب لنا الفرندوسكوب.
Okay, it's the same. Stethoscope, an endoscope. Around 50 years ago, stethoscope was called the stethoscope made by from wood, which
فتحت ورا بعدك؟
with the help of the stethoscope we are looking for hearing the heartbeat of the child. Do you know what kind of stethoscope? It's like like something
كل شيء مسجل.
wood made. And from the very beginning it was phonendoscope. Now it doesn't matter. Phonendoscope, stethoscope, it's the same thing. What we should do in order to find the lower margin of the stomach? You put the phonendoscope or stethoscope here over the stomach, and you make this.